Good evening and welcome to African Perspective. That press briefing that you were listening to there earlier on was with the Minister of Health outlining the first phase of the inoculation process that will be taking place as soon as those vaccines arrive. The expectation is that the vaccines will arrive by Sunday, and the Minister saying that the vaccines only leaving India on Sunday, so not too sure when it will arrive in the country, but the promise was that it will be in the country by Sunday, and then the first phase of the inoculation and the vaccination would start, and of course the priority group being the health workers. Thank you so much for joining us this evening. We start off with this story where President Cyril Ramaphosa said that the coronavirus pandemic has caused great devastation in Africa. The continent has reported over 3.4 million cases and more than 87,000 deaths. The African Union chair was speaking on the Africa COVID-19 vaccine financing and deployment webinar.
It's a race against time for the Africa Vaccine Acquisition Task Team to come up with a clear program to procure vaccines for the continent. There has been an outcry as many fear the region will be left behind. The African Union chairperson has criticized countries who have bought vaccines doses in large quantities that disadvantage poorer countries. The pharmaceutical companies who have conducted COVID-19 vaccine trials on the continent weren't spared the tongue-lashing either.
The developed North, which has substantial financial resources, has purchased the largest stocks, while we in Africa are struggling to get our fair share. The painful irony is that some of the clinical trials for these vaccines were carried out in Africa. And now we cannot get access to the very vaccines that were tested on us. In other cases, vaccines are packaged right here on the African continent, yet we struggle to access them for our populations. Vaccine prices are high, and many countries may not afford to vaccinate enough of their population to achieve herd immunity.
He has called on the World Trade Organization to intervene.
Together with India, South Africa has proposed a TRIPS waiver in response to the pandemic. We are calling on the World Trade Organization to waive specific TRIPS obligations related to the prevention and treatment of COVID-19 for a defined period. We need more countries to support this initiative. This would enable countries in Africa and elsewhere to access active pharmaceutical ingredients and benefit from technology transfer, including the know-how to manufacture vaccines in Africa at a much cheaper cost.
The private sector has also put the shoulder on the wheel.
The AU team and the World Bank are collaborating to ensure that member states can have access to further funding. We appreciate the offer that has been made by MTN, a mobile telephony company on the African continent, to donate $25 million to the vaccine program of the Africa CDC to immunize health workers on our continent. This is solidarity in action.
Sophie Mkwena, SABC News, Johannesburg.